A new bill in the state capitol would make it easier to access birth control.
News 3 Now political reporter Will Keneally has more.
10 minutes of debate on this bill.
This new bill passing the state assembly today would allow pharmacists to directly prescribe birth control to patients. They would have to go through a blood pressure screening, but could then use their insurance without having to go through a doctor.
This bill will allow women to have more choices in reproductive health care, decrease the number of unplanned pregnancies.
This is a Republican-authored bill in an effort to reduce the number of unplanned pregnancies. Right now in Wisconsin, more than a quarter of pregnancies are unplanned, according to data from Public Health Madison-Dane County. The thought being, reduce the number of unplanned pregnancies and you reduce the number of abortions, increase overall health outcomes.
And the highest rate is among young women in poverty. These women are unlikely to finish school, and it will severely affect their potential earnings throughout their lives.
This bill received pretty wide bipartisan support, and I want to show you something a little behind the scenes here. This is the legislative history for this bill. Now, aside from a couple of administrative things, each one of these lines is another lawmaker adding their name to this bill as a co-sponsor. It's 47 lawmakers in all. That's pretty rare. In a statement ahead of the vote, Assembly Minority Leader Greta Neubauer tells us that, quote, today's floor calendar shows us that despite our disagreements, it is possible to come together to pass good bipartisan bills that will move our state forward. But we know there's so much work left to be done. The bill now heads to the state Senate. Reporting from the state capitol, Will Keneally, News 3 Now.